for anybody listening, the last couple months, I've been seriously, reconsidering my job. And, I've listened to the Honest Nurse podcast, and Nurse Trish, she is awesome. And, I just, she said some things, changed my life a little bit. 20 plus years in EMS, I'm kind of bored of carrying Granny down the steps. So I'm taking the plunge. I applied to nursing school, and I got in. And, I know dark side, whatever, but I'm going for it. So I kind of been asking around because I just kind of jumped into this with, both feet. And, I started asking some of my friends from, nurse friends from the ED that we've known for a while, what can I really expect in nursing school? I got a lot of weird responses, and I just kind of wanted to see where, where I'm going to land. So today, I've got not Nurse Trish, I got Nurse Chelsea on here to talk, and I consider her an expert in nursing. So Chelsea, thanks for coming on. I appreciate you sitting down. And why don't you tell us a little bit about yourself as a nurse and your healthcare and your nursing experience?
All right. Well, I'm Chelsea. I've been a nurse for about 7 years. My background is, first I started off as an ICU nurse for about a year and then transitioned to emergency medicine. Kind of didn't really want to stick there, just took the job because, well, it was offered to me in the interview and I needed to get back closer to home to working, but tried to leave one time to go back to ICU, and I think emergency medicine just kind of sticks with you. So I did transition back, and I've been in the ED now for 6 years. So exclusively night shifter. You will hardly see me during the daytime, but that's really about it. I love trauma and critical care patients. That's kind of my little niche.
And that's outstanding, and that's why I really wanted to talk to you, because I was night shift for 10 years full time before I went to the teaching thing, and I typically work full night shift when I work part time, but some day shifts, and we've seen each other in the ED, and you work with my wife, and I consider you an expert, and you're relatable to EMS. I know you've done a ride along or two with our ambulances, which is awesome. So, I mean, that's why when I got some of these responses from some other nurses, I was like, I'm going to check with Chelsea. So a couple things I'm looking forward to, I guess, or, you tell me if I'm off the mark. People I've talked to in the last couple of weeks about becoming a nurse and stuff I can look forward to. Really looking forward to getting mad when the medics don't give report. But when they do try to give a report, I'm just going to blow them off. Like, does that happen? I mean,
it happens. I'm not going to lie. I mean, just as well as I do, especially if you're coming into like the trauma bay or critical care, like they have their little algorithms that they want to work through. And I do feel like, I try to give people a chance, but there's just like there's some nurses, there's some medics that just come in and you kind of roll your eyes like, okay, let's just get this patient over. But I try to set a good example and, listening to them and kind of giving them their time to talk, because we really don't know anything about this patient without y'all's help. So, it's, and I'm a person that kind of tries to foster that relationship between ER and EMS, because it's kind of one and the same. Especially that type of nursing, it's very unique. You can't really relate to nurses in the ICU or nurses on the floor. Like, y'all are kind of all we have. Like, if we have a bad night, you guys kind of are the closest thing that we have to understanding. So, I'm all for fostering the relationship, but I'm not going to lie and say it doesn't happen. Definitely happens. Not something that I'm proud of, but yeah.
I'm totally going to do it. I'm just going to pretend. I'm just going to look in the computer and just be like, what's the social security number? And then just look up the EMR.
Well, there is a method to that. And I know that I'm one that when they start talking, I'm like, just give me your tablet, give me your tablet, give me your tablet. But I don't want you to have to repeat yourself. So if I can get the EMR already up, like I can type while you're talking, but I didn't, I do think now thinking about it, that is kind of a disrespect thing, but it's really just to try to be efficient when I do it. I don't know about other people, but
it made me sad as a medic, but I can't wait to like turn the tables on them when I'm a nurse. So I'll try and keep it under control. We'll see. Is it true that RN really stands for refreshments and narcotics?
Yeah, so that is pretty accurate. There's a lot of you have a lot of autonomy as an ER nurse, but a lot of it is just making people happy while they wait for whatever test. The you're not really there's a physician always close by. So, I mean, you have autonomy, but you kind of have somebody there that you're like asking permission for everything that you do. It's the autonomy is a lot different than EMS. So yeah, a lot of it is just making people happy, getting them a sandwich or they're Dilaudid or a drink or a pillow if you can find one.
Well, I can't wait to use my my degree to do that. It's going to be awesome. I also heard someone else told me that at least once a shift I should listen to an EMS handoff without asking like 10,000 questions or cut off the medics like every 5 seconds with other questions.
Yeah, so this what you're saying kind of brings to mind one time your good friend Clardy brought a patient into the trauma bay, and that's where most notoriously you get interrupted and people just essentially don't care about anything you're about to say. And he gave the loudest report that you've ever heard. I mean, he was essentially yelling over top of everybody. And I just remember the trauma attending, he was just laughing his ass off at Clardy because he already knew. He knew exactly what he was doing because he knows people just don't listen. But yeah, I mean, like I said before, there's those medics where they come in the trauma bay or your recess room and you're like, oh, dear Jesus, here we go. But I mean, you should. And sometimes you can see improvement in their report. Sometimes people get better. Like, okay, I give you a little credit. Like, you got your shit together a little bit more this time than you did the last time.
That's funny. Well, when I become a nurse, I'm going to forget everything I remembered as a medic and just do it the nurse way. So is it, when I say about forgetting everything I knew as a medic, like, is it important for me to absolutely just forget or not pretend like I don't know the paramedic scope of practice and like what they can and can't do and their actual capabilities? That way, I can cut them off every 5 seconds or pretend like, oh, I didn't know you could do that. Thanks. Or why didn't you put that IV in with that finger pain and make my job easier? Like, I should be like that, right?
Absolutely. If you want to give somebody a hard time, I'm not a paramedic, so I don't really know their scope of practice, but it is really easy to kind of be the Monday morning quarterback. Like, well, this was happening. Why didn't you do this? I mean, and that's one of the reasons that I wanted to do the ride along, not only because, I too am considering a career change of something else. Like I do love nursing, the actual patient care. There's just a lot of other aspects of it that I don't love, but to kind of see what the other side is like and the environment that they come from. And, during my ride along, like, we had a really sick patient, and I mean, this lady was sick as shit. Like, she couldn't breathe. She was diaphoretic. Like, she kind of looked like a STEMI, but I mean, hell, it was 500 degrees in that house. And all I could think was like, let's just get this lady the fuck out of here so we can just figure out what's going on with her. And I mean, it's easy now to look back and say, like, the lady sat was like in the 70s in her bedroom. Like, you probably should have been more focused on that. But I mean, it is easy to kind of to judge after the fact, but I mean, I try to keep that in mind, that they're like, unideal situations that they're working in. They don't have an ER with, all of the equipment and all of the resources that we have. It's kind of just them and their partner, and, they're in some place that it has to smell bad because every place I went in smelled like someone took a shit right in the room. But yeah, I mean, you giving somebody a hard time, I mean, you're Chris Ruggiero, so you can pretty much do whatever you want to do, but
So, well, I mean, that's why, I maybe I should have done maybe like air quotes. You can't see it because it's, podcasting. I should have probably done a ride along with nursing before I applied, because I mean, you're saying some things. I mean, I relate to that absolutely in the field. I mean, I get it, but this whole having the scope of practice and the standing orders, that is awesome, but everyone tells me, nurses, pretty much just obey the doctor, no questions asked. I mean, that's really going to be different from me following standing orders and having to call for, a few things. But I mean, I'm willing to trade that off for a couple other of the perks of, like you just said, being in the ED. It's, it's climate controlled. There's really good lighting. And, at least I get to take, regular bathroom breaks. I get a full lunch break. I mean, because, if I had a nickel for every time I missed a meal in EMS, I should be thinner than I am, but I don't know how I stayed so many years. I mean, I'm looking forward to, you're moving around on your feet all day, but regular bathroom breaks and full lunch break. I mean, you guys have it made, right?
Yeah, I mean, the autonomy piece is different, and that's something that I kind of look for more autonomy. I mean, I kind of joke frequently with pharmacy, like, hey, can you verify this ibuprofen? I got a bachelor's degree in nursing, but I can't even override an ibuprofen. Um, and whatever my career change will be, like, I definitely am looking for a lot more autonomy. But yeah, I mean, based on my experience, I've done 2 EMS ride-alongs now, and the just the environment alone of coming out of the ER where, there is climate control. It's not raining on you. There's no dogs that are like, you know, growling at you, or there's bathrooms that are usable. I mean, Clardy, on my last ride along before we kind of left, he was like, "You got to pee?" I was like, I mean, no, I think I'm good. And he was like, "Are you sure? Because there's nowhere to go to the bathroom at." And I kind of didn't think about that. And I was like, "Oh, maybe I will go pee." So, went to go pee at headquarters and then kind of got on the truck. And I was like, well, I guess I'm holding it until we go to the hospital, because even the EMS stations that we went, I was like, this seems questionable to pee. And even then, you're kind of on like a high alert. Like, I was afraid to kind of separate from the medics at all to go to the bathroom, because, like, what if we get a call? Like, am I going to get left here at this, shitty EMS station by myself if I'm if I'm peeing? Like, what's going to happen?
Well,
So
you were wearing,
there
I think
are,
you were wearing scrubs on that ride along, right? Like you weren't like in an EMS uniform like me. You got to take the bat belt off. You got to hang it on the hook, and then you get caught with the tones go off. You got to put the bat belt back on and the belt keepers and tuck everything back in. And it's kind of, I get it. That's why, again, looking forward to becoming super ED nurse, where I just go whenever I want and take as long as I want. No pagers.
yeah, I mean, I think the biggest thing about, we've had a lot of people transition from EMS to nursing, and I think the biggest obstacle that they face is kind of like, when you're on the truck, like, you may have a couple of patients, but most of the time, if y'all are bringing multiple patients, they're kind of low acuity patients. I mean, you may bring two, trauma activations, but, you're not bringing two bad breathers or two, unconscious patients in your truck. So that's the biggest transition that I see, is they have difficulty moving from that one or two patient mentality to, like, okay, now I've got 4 patients, and 3 of them, maybe bullshit, but they still, need tasks or assessments or whatever. And then I got this really one sick patient that I kind of want to spend all my time with, but, you have to retrain yourself to time management skills, are a big thing, like a big issue with that I see. I mean, they're very competent people usually when they come over, to the dark side, as you call it, but it's just the time management aspect of it that's the biggest obstacle for them.
I'm bad at time management. I'll get better. I'll try. So I mean, all that aside, I mean, I'm also, I guess this is probably pretty. I mean, this was a questionable piece of advice. Like when I asked, like, what do real nurses do? Like, what in the ED? I thought this was maybe a floor nurse thing. I don't know, and I don't, no, I'm not making fun of floor nurses, but I don't really know the difference. Somebody just said wipe butts, hold nuts. That's kind of weird. I don't. If there's advanced practice degrees that I don't have to do that, I'm in. Because I mean, I don't really. I'm not gonna lie. I've done that in EMS, but I don't want to do it in nursing.
Yeah, no, that's pretty accurate. I mean, most of these people coming in, like, if a lot of them, I mean, as good as I do, that they're not really that sick, but, it is a lot of ass wiping and, hold nuts, like, yeah, holding a lot of nuts, seeing a lot of genitalia.
Is there like I mean, is that really like a class? Like, is that maybe an elective I'm going to have to worry about, or I don't know. I'm not looking forward to it.
As asinine as it is, there really is like a whole kind of section in your whatever your fundamentals of nursing is that kind of tells you how to do it. Like, as intuitive as it seems to just kind of wipe somebody's ass, like, they do teach you how to do that, which is the definition of nursing. They hold your hand for almost everything.
I think you guys deserve a medal for that. There should be extra credit. Another person said just don't listen to EMS reports, and then another one, and this was a person who they hold dual certs. They're a nurse and a medic, and it just said get a turkey sandwich, and I thought that maybe went with the whole refreshments and narcotics thing. So a warm blanket and ice chips and stuff like that. So I think I can handle that.
Yeah, I mean, that's all. If you can hand out blankets and ice chips, like, you're golden. You're golden.
All right, so I can blow off all, like, the advanced hemodynamic monitoring and, like, all the all the fun stuff I'm used to, and then just focus on wipe butts, hold nuts, get turkey sandwiches, warm blanket, ice chips.
Yeah, and I mean, focus on the fact that like, you have a refrigerator on site, you got a bathroom there, relatively clean. We got housekeeping that comes and cleans our bathroom. That's a pretty cake job.
All right, I'm pretty sure I'm making the right decision. I can't wait to be. I don't know. Do you guys call it like we do in EMS? Do you guys call it like the brotherhood? I don't want to say sisterhood because there's a lot of dudes who are nurses now, and I don't want to. Do you guys have like the brotherhood and like cool T-shirts, like stupid T-shirts that are like we have like Race the Reaper, I Fight What You Fear, paid to save your ass, not kiss it. Hard. That's just that. I want something like that, but for nursing. Like, can we do that?
I mean, you would kind of be breaking some new ground there. Nursing, I mean, we have the ER nurses are a little bit more of that kind of brotherhood kind of mentality, but nursing as a whole is very diversified, I guess would be a good way to put that. The ER is kind of like the black sheep of nursing, so we kind of have to accept our own because the floors hate us, the ICUs hate us, the ORs hate us. So
I know there's always that that like that turf war between ICU and the ED. I like that. I want to be part of that. I want to win that fight. And I've heard what's some other stuff I've heard. I've said it on other podcasts. I'll change my attitude probably. But like if I was going to give the hospital an enema, like the ED is where I would stick the tube because it's just the worst. But I mean, like that's where I want to work. Like I've been in the ICU with family members, and like it's pretty clean, and all the beeping up there, like that, it'd drive me nuts. I can't do it. Like at 10 minutes, maybe it's because I have kids, and like noises bother me like that, or maybe it's all my EMS PTSD. I don't know, but I just can't. I can't deal with that beeping. I got to get out of there.
Well, it's the best and the worst place to work. I mean, I've been there for a long time, but it's probably damaged me a little bit. But it's the best and the worst place. I mean, if you really want to kind of go somewhere where there's no limits, I mean, you can never say no. You can never say, oh, don't bring this, at least at the facility I work at, we can't say, don't bring this EMS there. Like, take them somewhere else. Take them to one of the outlying facilities. I mean, we can suggest it, but at the end of the day, like, we can't say no.
Yeah, not your hospital. You got the big white T in front of that thing, so Regional Trauma Center. Sorry.
Yeah. I mean, so you kind of test your limits as a nurse. Like in the ICU, you kind of have even, your patients are really sick and you can't give them to anybody unless you take them to the OR or the morgue. But I mean, in the ER, you get those same really sick patients, but at the same time, like there's always that like lingering thought of like, God, I hope there's like a bus crash or something that's happening during this, all of these intubated patients that we have. Or, I mean, it's a great place to work. It's a hard place to start for new grads, because it's just, there's not a good focus on the things that I think that you should focus on as a new nurse or a new, any kind of practitioner really. But most of the people that come from EMS are fine with like the assessment portion and knowing when people are sick. But when you're trying to learn if people are sick or not sick and you're literally getting flooded with patients, I mean, that's very overwhelming. And a lot of our new grad nurses go through a kind of like there's like a letdown period after school, which I'm sure it's the same as EMS, where you like, I didn't think it was going to be like this, and that happens a lot in the ER, and we lose a lot of people after a year or two because they just don't think that it's going to be like that. There's kind of for the lack of a better word, like a moral injury that happens to you, and you kind of just, you don't really know what to do with that. So either people leave or they stay and, become real cynical people like me. So.
Awesome. You sound like a medic. I'm glad I talked to you. And I'm jumping in feet first, and I guess now that you've got that out in the open and helped me out with that, I'm questioning it. We'll see what happens. And real quick, if any of my normal listeners are listening to this and have been going, dude, what are you doing? You're just letting me down. What are you, stupid? It's April Fool's. It's April 1st. Come on. What is wrong with you? I would never leave EMS. I love it. And let's face it, if you guys are listening to the Honest Nurse podcast, you guys are awesome. Listen to Nurse Trish. She's awesome. You guys can find her. You guys already probably know where she's at. On Instagram at all lowercase letters, the.honest.nurse, and you can just search her out on iTunes and listen to all her podcasts. she's really helping out those student nurses, those graduate nurses, people thinking about getting into the job. Listen to her. Don't listen to me. Listen to me about EMS stuff. Listen to Chelsea. Chelsea knows what's what. I really appreciate you coming on. Around here in the upstate of South Carolina, she talked about him already. You guys heard him on, if you guys want to go back and listen to episodes 8 and 9 of my podcast, the Medic Up podcast, James Clardy, super rockstar paramedic. He calls the nurses in the area the real nurses. RN stands for real nurses. I follow that up with rockstar nurses. And let's face it, around this place in that ED, people like Chelsea, they've run that shit. And when we come in, we know we're handing our people off. We're handing our patients off to the best nurses in the upstate. I tell the patient all the time, you're going to the best nurses in the upstate. It's all good. They're going to take good care of you. You know, you're in good hands. So I appreciate everything you guys do. You guys rock. And again, come on, really? Chris, in nursing, what is wrong with you? Why do you even listen to this podcast? So Chelsea, thanks. I appreciate all the help, and I appreciate your candor and your honest answers. And I don't know, I don't think I could do what you do, so I appreciate it.
Yeah, no problem. Thank you for